Hello, I'm Smriti. I'm a special educator and a counseling psychologist. I'm a parent of a child who diagnosed with autism. My child Advait is 14-year-old now. Last 11 years I'm working in this field. I used to conduct training programs for parents. So this video I'm making for the awareness of what is meant by special education. Always parents used to confuse about the ABA or speech therapy or special educator and occupational therapy and all. So today I am explaining you all about special education. What is meant by special education and how you can find a good special educator for your child. If your child is getting the diagnosis of autism, maybe between the age of 2 to 8 years, it is important to provide a lot of one-on-one sessions for the child. When the child is between the age of 7 to 8 years, you have to look for school programs according to your child's level, maybe special school or an inclusive school or something, but at that time the child should go for group sessions. Between the age of 2 to 8, it is important to provide the one-on-one session. So at that time special education is very very important. And for a child with autism, the strategies are different from other disabilities. So we have to find a special educator who knows about autism, who has experience to work with children with autism. So a good special educator will focus into the overall development of the child, the holistic development of the child. Autism is mainly affecting a child's ability to communicate, interact with people, and some repetitive behaviors. So these are the core deficits of autism, and a special educator should focus into these three areas: how to develop the communication skills in the child, how to improve the social skills in the child, how to handle the repetitive behaviors. If there is any sensory issues, how to handle that sensory issues with the help of an occupational therapist, and then only learning will happen. So occupational therapy and sensory integration is a very important part in learning. If the child is disturbed because of the sensory issues, the learning readiness won't be there. When a child is not ready to learn, if we are forcefully making them sit and learn, learning is not going to happen. So first is an occupational therapy with the proper sensory integration techniques that will help the child to improve his sitting tolerance, to improve his focus and attention, and then the child will be ready to learn, and at the time a special educator can teach various concepts to the child. And of course, a special educator should involve goals in communication, how to improve the communication skills. And they should provide time for parents to make them understand that how they can use these techniques in the home environment, so that the child can use their communication skills in a generalized way in the home environment, outside the home, in all the social situations, how a child can improve their social skills, how we can work for all the difficulties if the child is facing all these difficulties in their social skills, how it can improve. All these tips a special educator can give to the mother or the parents, so that they can lead a better life. So a special educator should spend time with parents also. So last 10 minutes they should interact with the parent to make them understand that these all the things you can try in the home environment. So the special education is not only the tabletop learning like teaching reading, teaching academics or maths or something. Not only that, how a child can learn various daily life skills like bathing, brushing, dressing, eating. All these things should be a part of the special education. And if the child is 10 plus, what areas we are going to focus. So if the child is 8 plus or 9 plus, and if the child is not able to write, they can focus into typing by that time, how to improve, and what are the strength. They should be able to find what are the strength of your child. Is your child good in physical activity, or your child is good in painting, or your child is good in music, and use that as a medium to move forward. Give more importance to their strengths, at the same time help them to improve in their difficult areas also. That should be the focus from the special educator, and that should be the message a parent also should get. And a parent can also ask their doubt with the special educator, and so that in the behavior modification, so the repetitive behaviors or other disturbing or aggressive behaviors is if present, how to handle that behavior, how to adjust with that behavior, what are the behavior modification techniques can work for that behavior. A good special educator can help you in all these areas. A special educator is trained how to do the behavior, trained for how to do the behavior modification. So no need for extra sessions for that. We discuss with your special educator and find the proper techniques to improve the behavior modifications. So these are the main areas you have to focus while doing special education. So special education is not only teaching the child ABCD 1 2 3 like that. Special education is something that for all the areas, it's related to the holistic development of the children. It will focus into all areas of the child, how the child is going to socially interact with the people, how the child is going to do their daily life skills, how the child is going to do academics, how the child is going to learn various skills related according to their strength, like different sports activities, how to improve their fine motor skills. Everything should be a part of special education, so that that special educator can help you to teach the vocational skills also, and how to move forward for a long term. So like that, a special educator can be an important part in your life, and it's very important to find take guidance from a special educator to move forward. And when they are attending workshops and all, you try to attend and learn from that. That will be really helpful for you. So in this video I am explaining about what is meant by special education. So special education is not something that is totally different, that there is something, there is a proper method, this way only we will do. There is nothing like that. So for example, when we will teach various concepts to the children. It starts with shapes, colors, and then common objects, function of objects, then different fruits, vegetables, vehicles, animals, then categorization of these, sorting of colors and shapes, all these things we will do. And then we will introduce adjectives, prepositions, we will work for the visual perception skills, and then only comes to academics. So a good special educator will check on all these things, and visual perception skills, and then they will come to the academics. And academics also, each child is different. Some children may be verbal, some children may be non-verbal, some children can learn in a different way, but the other children can do it in a different way. So according to that child's understanding level, we have to make changes in the program. We have to do the proper task analysis. For this child, I have to split this task into 12 steps, but for this child, I have to do the same goal in 5 steps I can achieve. These two children are different. So if I'm able to find that, I'm doing the proper special education technique. And for a typical child, a lesson when we are teaching, we are just reading, we are just opening the textbook, we are just reading, and the child is understanding, and then we are doing question answers, and that lesson is over. But for a special need child, we have to use more visuals, we have to show more videos, we have to give them different exposure to touch, feel, and understand. And we have to do a lot in the object level, and then only we will come to the picture level, and then only we will come to the question answer word level, like that. If you are doing that, the learning will be proper for a special need child. Otherwise only rote learning will happen, and child will just by heart, and then they may not be able to use it in their daily life. For example, when you are teaching opposite to a typical child, we will just teach them big opposite small, clean opposite dirty, long opposite short. But when you are working with a special need child, first we will take various objects that looks big and that looks small, and that will present in front of the child, and we will show them, see, this looks like this, so that is why this is big compared to this, and this is small compared to this. So in the object level we will show, and then pictures we will take, and then we will show this is a big car, and look, this is a small car, so this is bigger than this, so we will show in the object level. Then we will move to the worksheet level, and then only we will teach. So big opposite is small. Like that, if we are introducing clean dirty, if we are introducing prepositions, first we will show them how it is how that, what is the meaning of that, with using objects. Keep this in front of the bag, keep this on top of this. So like that, we will make them understand what is the mean by, what is the meaning of this, and how they are following instruction using the use of language, the use of academics, like that. So instead of just introducing the ad family, cat, rat, pat, pan, hat, we will take pictures, we will do lots of picture identification, word identification, word to picture matching, then fill in the blanks for the first sound, then dictation. So this is the difference between special educator and an educator. So when we are going to a typical school, we will just take that word, we'll just read, but our children may not be able to understand the meaning of that. So we have to use more visuals to make them understand. So a special educator can help you to form a proper program for each lesson what your child is learning. For all, like other children, we also used to teach our children about plants, about earth, about all, so EVS, everything we can teach our children, but we make a different lesson plan. So these are called the lesson plan. So first I will make a lesson plan, and in that lesson plan I will put into simple step. The task analysis I will do, I'll put it into simple steps, and according to the child's understanding, I will collect the material, and with the help of that material I will teach the child. That is what a special educator does in teaching. I hope you were able to understand about the special education. And if you have any more doubts, you can write in the comment section. I hope this video is helpful for all of you. Thank you.